India has the highest new COVID-19 cases in the world for 4 straight days now. What does this mean? What explains this spike?
So you're right, in absolute numbers, we have the highest number of cases for 4 straight days on each day. And that is basically related to the fact that our population is very large and the cases are now occurring in various areas, smaller cities and rural parts. And the cumulative number is quite big. We are also testing much more. We've crossed more than 6 lakh tests per day. So that is also adding to the load. So we are picking up more. We are having the disease in smaller cities in multiple states. And that is also accounting for the larger number of cases. If you want to look at it from the good point of view, if you look at it, number of cases per million population, we are much lower. If you look at the mortality is also much lower than what is being seen in various parts of the world.
All right, so that's of course, a brief analysis of the numbers, but could monsoons be linked to India's surge in COVID-19 cases? This is a question that's coming in from a lot of viewers as well, especially areas that are currently witnessing, either flood-like situations or just extremely heavy rain.
So there are two ways. One is that we know that many viruses can survive for a longer time in the environment if it is humid. And this is classically known for H1N1 swine flu. We classically get a peak during the monsoon months where we see more number of cases wherever there are rains, and this starts traditionally from the south, from usually Maharashtra and Karnataka, and goes upwards as the monsoon progresses.
Right.
This happens every year. COVID-19 is a new virus, but like most viruses, it can survive for a longer period of time, and therefore the chance of infection in the environment become higher. The second issue is, like you said, because of flooding, people tend to crowd together because they go to areas where they have their sort of rescue homes or areas where they have no choice but can't have physical distancing because of large areas which get flooded. And that also leads to a higher chance of the spread of infection.
Another very worrying phenomena that's been reported is, of course, relapse of COVID-19 cases. Can a relapse, Dr. Guleria, be more severe if you were to get one? And I'm saying this, of course, in context with the cop in Uttar Pradesh who died this week, who tested positive after testing negative twice.
So what happens is that sometimes you make tests negative because of various factors.
Okay.
Testing as far as RT-PCR, so we have two types of testing. One is the antigen-based test, which is a rapid test. It's a point-of-care test, but it has a low sensitivity. It can be false negative almost 30 to 40% of cases. So if you do a rapid antigen test and you are negative, it does not mean you are negative, because it may miss the diagnosis if the viral load is less.
Right.
Secondly, if you don't take the sample properly, you have to take a nasal swab. And I've seen in some areas, especially if the technician is not properly trained, he doesn't go deep into the nose because it has to be taken from the nasopharynx. That is the posterior part of the nose. If you just put the swab in the beginning at the entrance of the nose, you will not get good material and you will not be able to get a good swab. And same is from the throat swab. So the testing technique has to be proper and the sample has to be then processed properly. And again, if your viral load is less, you may have a false negative. And we have this challenge very frequently. We have people who have tested negative, but the clinical picture, the X-ray, the CT is classical for COVID-19. We admit them in a COVID suspect ward because they can neither go to a non-COVID ward, nor can they go to a COVID positive ward. And we keep retesting them, and many of them on the second or third time turn out to be positive. That doesn't mean that they were negative and it turned out to be positive. It's just that no test is 100% foolproof. And therefore, I personally feel that along with the test, you have to take what I call the clinico-radiological profile. And if your clinico-radiological profile is very suggestive of COVID, treat this patient as possible COVID, and you will have to treat him with the other drugs that we give for COVID, rather than denying him treatment just because his test has turned out to be negative, everything else is positive.